Doc Talk, sponsored by Geisinger Holy Spirit.
Heart failure can initially be subtle, and not getting it treated properly can have deadly results. In this week's Doc Talk, Ed Russo takes a closer look at the signs you should look out for.
Heart failure isn't necessarily one specific thing. It can be associated with many different types of symptoms.
For whatever reason, for whatever cause, the heart no longer efficiently delivers oxygen and nutrients to the body the way it would ordinarily. And because of that, different organs like the kidneys don't get the same amount of oxygen and nutrients and flow. So it actually tries to retain water and salt.
That fluid retention can spread to other parts of the body like the legs and cause swelling. With congestive heart failure, the lungs often fill up with fluid, hence the cough.
People start noticing like a dry cough, which actually becomes a wet, frothy cough as the fluid starts to accumulate there. And that's because it's a nice, big, available space. It's easy to sort of put that fluid into there.
One of the big demographics where heart failure is more prevalent are people over the age of 65. People that suffer from diabetes, high blood pressure, and obesity are also at higher risk. The good news is that heart failure can be quite treatable.
So there's medications that oftentimes we use, medications that control blood pressure, that decrease fluid in the system, that allow the heart to squeeze more efficiently. Controlling the various risk factors are important. So diabetes control, patients having cholesterol control to prevent coronary artery disease.
It goes without saying that lifestyle and dietary decisions are of the utmost importance in treating ongoing heart failure and preventing it.
Congestive heart failure doesn't necessarily mean that you're sort of at the end. I think there's a connotation that heart failure means that you're close to death.
And that connotation is often wrong because when taking the right steps, your prognosis can end up fairly positive. For this week's Doc Talk, I'm Ed Russo, CBS 21 News.